This is actually the third statewide meeting that MPRO's put on that I've been at, and my biggest takeaway is the number of folks that are attending, the level of interest that's ramped up over the last 2 years.
There's a huge need for us all to get together and have these kinds of community conversations to understand what's going on and to collaborate better. This conference is fulfilling a great need.
I was really interested in the session where we talked about some of the IT infrastructure and challenges related to that, and they were relating that back to the MyPIC program and taking a look at what are the ambulatory strategies that are surfacing, that have been coming to the surface as it relates to care transitions.
The biggest takeaway for me is really the continuation of communication that needs to be had between all of the players in the room. We're all working towards the same goals. I find that there's a lot of common elements. Everybody's talking about the same things, but we still haven't had all of those conversations together.
A lot of my focus and my energy is spent on trying to improve communication, coordination, cooperation. I'm very excited about what this whole group is coming together to talk about today.
I'm very much looking forward to next year as these care transition programs continue to grow, to identify new challenges and opportunities, especially as the Affordable Care Act continues to roll out. I think we're going to start seeing some new models.
I have worked with MPRO. They were a very important partner for us when we started down the road of working on care transitions, providing support, providing data and insight.
MPRO is a wonderful partner of GDAC's. We work well together on a number of projects, and we're very fortunate to have such a partnership-oriented QIO in our state.
People I've worked with have been great, very supportive. Frankly, we wouldn't have gotten to the point we're at in this community without their help, and continue to look for that help as far as data management and new ideas and bringing people together like this from different communities.
MPRO was really instrumental with Detroit Area Agency on Aging in identifying a lot of the data pieces as it relates to care transitions, and I know that they're also working very directly with the partners that we have, DMC, and some of the work that we've done with Henry Ford to really help us pinpoint who's the target audience and how can we best impact them.
For me, it's like being good neighbors. So MPRO and everybody else, it's just nice to get to know your neighbors and work together.